Hello and welcome. I'm Nikhil Singh, and this is my channel where I'll be documenting my journey through osteochondritis dissecans. If you're watching this video, you're probably wondering, out of curiosity or out of concern, what is OCD in the knee? And I made this channel so that people can find a source where they can ask questions and feel less clueless about all the questions you people have. And one of the things I felt when I was found with OCD was that there's nothing online about this topic because it's so under researched. And I wanted to help other kids and families know that other people are there and are facing the same thing as you guys. And I wanted to say thank you before we get in to the ROCK organization. Their research is on their free website, really helps a lot. So if you have any questions, you can ask me in the comments, and any questions about their team of doctors, you can look at ocdknee.org. And I wanted also to say thank you to the doctors on this team helping me and thousands of other people across the world get through OCD in the knee. So, what is osteochondritis dissecans in the knee? How does it come into the lives of people all across the world? What are the risk rates? Let's dive in. OCD is an orthopedic joint condition. Osteo, meaning bone related, chondra, meaning cartilage related, itis, meaning inflammation, and dissecans, meaning separating or coming apart. Altogether, meaning that OCD is inflamed bone and separated cartilage. But it's always not this simple and can change depending on the situation. Imagine it this way: a Venn diagram where the two main things doctors look at are cartilage versus bone issue and inflammation versus blood circulation problem. Like if the problem is related to cartilage, then these defects can be found only on MRI scans, versus bone separations can often be visible on x-rays. Off of that, OCD is generally only found in kids from ages 12 to 16. Cases can vary because of certain factors like genetics and everyday stress on joints. Me as an 11-year-old was not in that ideal age group, but everything is still not known about why OCD comes into the lives of people all across the world. OCD is often not the same and can differ in the sense of where on the knee, how it comes, why it's staying, and what have the doctors done and what are they going to do. There's a long list of things that can change the outcome of OCD and change how people recover. Some commonly asked questions about OCD are: what are the risk weights that I get OCD? And 2, what are the chances that I get OCD in another joint in my body after I get it the first time? 3, what does osteochondritis dissecans mean long term for my child's health? Okay, it's question answering time. The chances that you get OCD are less than 1 in 1,000 from kids from 12 to 16, and from 11 to 20, the chances differ from anyway to 1 in 30,000 to 1 in 20,000, because OCD is only found generally in kids who are experiencing growth spurts and are feeling more pressure on the joints and are facing more weight bearing. But there are also rare cases where the grown-ups can get OCD, but we're not going to jump into that yet. And another commonly asked question was, what are the chances that I'll get it in my other leg if I have it in one leg? And there's a little bit of bad news. OCD in the knee is bilateral, meaning that if you get it in one leg, there's a 1 in 4 chance that you'll get it in the other leg. So it's good to be careful and know what all of the joints in your body are doing, because the pressure is not usually only under one leg, it's under both legs. So you could have it in both legs, and you need to be careful managing how much you're doing on both legs. And then the question that was most asked, I found, was, what does OCD in the knee mean for my child's growth overall? And I have good news. OCD, if treated properly before it gets stage 3, stage 4, where they're doing grafting and very hefty surgeries, can not at all differ how your child grows. And once the OCD is gone, your knee will completely grow fine, and it always almost catches up to speed. And so your upper body, while you have OCD in either one of your legs, will still grow. And then once the OCD in the knee is gone, then the rest of your leg will grow together as the knee heals. And if it's not going away, that knee, then to speed up that growing process, they'll often bring in surgical interference, which can speed up that process. Nothing to be worried about. Me personally getting that in a few days, and the lower part of the body will still catch up. And so there's nothing to be worried about when you get OCD. It's normal. People all over the world get it. They get it in their elbow, they get it in the ankle, they get it in the knee. And so it's important that you stay calm, you relax, try to get your mind off it. Don't overthink anything. And I hope you got a good idea about the simple terms of what OCD is and how it affects people. And maybe I've even answered some of your questions. If you still have questions, feel free to ask them in the comments, and I'll get to them now. And I'll begin my personal journey of what I'm going to do for the next few weeks before and after surgery. And I'll try to keep up with all your questions, answer them in the next video. And the week of May 18th and the week before and after May 18th, I will be posting mere daily videos. And stay safe, and I hope you enjoyed and learned.